Good morning, everyone. Hope everything is well, especially after the American election. Anyway, try to stop me when I exceed the time limit. I'm out of control sometimes. Okay, so today's presentation about tips for a better CT exam. I'm sure that most of you, or if not all of you, have a good experience in CT procedure. What we'll do is just share some of the experiences that we have theoretically and practically. I put it into tip number 1, but actually all the rest of the presentation comes only under tip number 1. There is no other tip, just tip number 1. Know your basics, know your principles. Without it, you will not be able to understand the mechanism of image construction or artifact avoidance. The problem that we have, even if it is a psychological problem, always try to compare how much we know with how much we understand. And we don't know when do we fill this gap. An easy method I apply is I compare how much I have learned and how much of it I can teach. It's important to you when you have someone asking you a question, you are able to answer it. This will show how much you understand. It's not a matter of memorizing all the details for an exam. It is just making a picture in your mind of the process that you are working on. So what is the benefit of learning and knowing? It can help you avoiding artifacts. 1 minute. It can help you in avoiding artifacts, avoiding repeated procedure and examinations, and reducing radiation dose. Also makes a connection between you as a person and you as a professional technologist. You can feel your value. Increases your self-confidence just by knowing. Might not affect what you are doing, but at least emotionally it will increase your self-confidence and prevents an imposter syndrome. I was advised not to go through it, but I love the principle. So I'll just go through a basic one of image construction, CT image construction. The oldest one is the back projection method. The first method that was advised. And I'll just explain it very quickly. Just imagine, just to simplify things, we have a CT X-ray tube and we have a matrix, an object which has 4 pixels only. So when you expose and you get an exposure value at the end of the detector. It could be 5 and 7 or any number. And then the CT tube will rotate, let's say for 90 degrees. We'll not mention the 360 degrees, just 90 degrees, and make another exposure at the same matrix, but from a different angle. So we'll get another exposure value. It's a cumulative of these values. And now the computer in the CT will try to estimate what are the values inside each pixel. So it will calculate it according to the number of exposure value, and it will give a value for each pixel. So 3 plus 2 equals 5, 3 plus 1 equals 4. It could be other numbers, but it will not be, because the CT machine will also get to check the values from different angles. So this is how to make sure that each pixel has a certain value. And then what it will do, it will replace these exposure values with density values. Now we have a basic matrix of a CT image from 2 projections only. To make it more complex, increase the angles that the exposure is made, and increase the size, the matrix size. Okay, and apply the same method. We'll again get a matrix with values, replace it with density values, and you get an image. Now, just apply it, multiply it by 1,000 pixels, for example, and you get the same image. Following a very basic principles of back projection. There are other methods, other more complex methods. This is the basic method. Each pixel will produce a certain value, which is a Hounsfield unit value. This is very important in CT because it will show the tissue component according to their atomic number and attenuation in that pixel. So from bone, which is around 1,000, to air, and the rest of the tissues in the body. Of course, it's not limited to 1,000. It can reach up to, for example, 30,000, 40,000. There is no upper limit. Why Hounsfield unit is important? For example, if you want to compare between the age of the subedural hematoma, how old is it in days? You can know by the Hounsfield number. If you want to differentiate between a blood vessel which is injected with contrast, you want to differentiate between the contrast media and the calcification. You can know by viewing the Hounsfield unit. If there was an accident, a patient had an accident, and there is glass foreign bodies in the patient, you want to know if it is a car glass or a normal glass. You can know, so you will know that if it is a car accident or a home accident. You can know if the cholesterol, if the gallbladder stone is made of cholesterol or bilirubin. You can know if the urine has blood or pus or just pure urine. And for ladies, you can also know if your jewelry is made of pure gold or mixed with copper. They have different Hounsfield unit. It's recommended that each CT control room has this list, and this is just a small list with each Hounsfield unit, each specific tissue type, as a reference for the technologist and for the radiologist. Taking into consideration that the Hounsfield unit is not always the same. There's an artifact called a pseudo-enhancement artifact, which, for example, when you inject a kidney and it has a cyst, the Hounsfield unit might change according to the enhancement around it from contrast media. So you have to take this in consideration. When we talk about preparing for a procedure or examination, we always mention room preparation and patient preparation. Unfortunately, we don't talk about the technologist preparation. The technologist has to be prepared to receive the patient, mentally and physically. The first impression is very important to make with the patient. So mentally, the technologist should keep in mind that the patient comes to the procedure fasting. They did not have their routine food, breakfast, coffee, tea, smoking. Okay? They might be a little bit agitated and grouchy. So if they become angry, don't take it personally. Don't escalate. Try to feel the reason that they are angry from and try to resolve it. On the other hand, if the patient is not angry, they are afraid, they might ask silly questions. Okay? And very silly questions that to the degree that you might feel it is undermining your knowledge or position. Okay? Again, know that these silly questions sometimes they are not looking for answers, but rather they are looking for human connection. They might ask you, is it painful? Or is it cold? Is it hot? How long it will take? These are silly questions that you might feel that you are answering them every day. Again, answer them, but answer them with a smile. Why smiling is important? Smiling is a nonverbal communication. It's a positive nonverbal communication, positive connection with other people. You don't have to say, hi, how are you? You don't have to say anything. Just a glimpse of your smile will make the patient feel better, more comfortable with you dealing with them. Okay? Eventually, it will make you feel better, even if you force yourself to smile. Just imagine which face do you want to connect with. Okay. I'm sure that you are smiling just because this lady has forced herself to smile. Now, how do you do it when you are wearing a mask? You can still smile with your eye. The eyes smiles also, not just the mouth. You don't have to have a Hollywood smile to smile. Just using your eyes, you can show that you are happy and you are smiling. Makes the patient more comfortable and it will make them relax. Connecting with different backgrounds and different ages of patients. Okay? One of the things I enjoy when I connect with a patient or doing a procedure in general is that I connect with the patient history and emotions. Okay? It's one of the best times to go away from the routine that we do. We know that each projection is supine or prone. Okay? There is not much difference about it. But what makes it different is the patient themselves. Each patient is different. So try to connect with the patient and try to make yourself remember your personality and your memories and your experience when you were at the patient's age. Or try to at least imagine what if you were at the patient's age. What is important for you now? Try to distract them, try to attract them by distracting them from the current procedure. When the patient is inside the room or even before, my advice is always dim the light. Why? There is science behind it. Dimming the light, the room light, reduces anxiety of the patient. This has been proved scientifically. The other reason is that dimming the light also provides privacy for the patient. They feel more comfortable if the light is dimmed. There is less details of their body, whether they are wearing a gown or their normal clothes, if they are lying down. It provides more privacy for the patient. It also provides a better viewing environment for the rad-tech, especially if they are viewing the monitors. If you think that the light is too dimmed or there is no in between, try to have a focus spotlight in the area that you are working. Okay? But will increase the light in that area without increasing the overall light in the whole room. That's why the hotel rooms, the nice hotel rooms, will always provide you with a dimmed light. This will give you a positive feeling compared to other hotel rooms which has a fluorescent light. If you still don't want or you can't dim the lights, ask the patient if they prefer an eye cover. It works like, there is a science also behind it. When you cover the eye, the patient will relax and their anxiety will be reduced. If you don't have an eye cover, you can use a pillowcase, just fold it and put it on the patient. Make sure that you are not closing their nostrils. When we are in a race, we try to save time. We are in a marathon race, we try to save. But when you want to win a patient, you have to spend more time with the patient, not less time. There is no race in the examination other than the patient care and radiation room. So you spend more time. What do? You ask the patient, you communicate with the patient in regards of their preparation, instruction. You confirm the history and correlate it to the indications. Select the proper protocol. It will also, communicating with the patient, make you avoid artifacts, metallic and plastic articles, just by communicating with the patient. Breathing instruction also are given the patient in the beginning and just before you start the examination. So one of the problems with breathing instruction, we think that the patient understands what we are saying. The best way is to practice it in front of them, to show them how it is done and how deep is it done. If the patient doesn't speak your language, you can use the 1-2 or 1-2-3 technique. So, for example, 1, 2, 1, 2. You do this while you are showing. You do this while you are showing the patient how it is. So you want them to take a deep breath continually, or to take a deep breath and stop it. You mention it in the 1, 2, 3 and stop. This is the 1, 2, 3 technique. Try to build a friendly relationship with your patient. I know that some of the female technologists in our society have a reservation with being too friendly with male, but I leave that to your consideration. At least with a pediatric and geriatric patient, try to build a friendly relationship. Your patient will like to feel nervous about the scan. A lot of things to fear when you are going for a CT scan. It's not a normal hand and finger. You don't know what you will find out. You don't know what the procedure is like. You are afraid of the report how long it will take, and so on. It will make them feel nervous. To reduce their anxiety again, ask them about themselves. Like you are talking about with a friend. Connect to them with their silly memories, okay, when they were a child, or when they went abroad, or when they were with a friend, and so on. This usually distracts them, takes them away from the procedure itself, and reduces their anxiety. I cannot emphasize more on having a smile as a connection. It is the best way to make the patient trust you, so that when you try to reassure them, they will believe you. In regard of ECG leads, one of the bad practices is to keep the ECG leads like floating everywhere. They will produce double artifact. So if you are scanning, for example, in this chest, if you are scanning in this line, you will see a lead here and then another lead here. And the same thing here. So instead of the lead going up and down, it has to be directed either up or down. So if your area of interest is the heart, your leads should be positioned from up. If your area of interest is the apices, your leads should be directed downwards. And if, as much as possible, to be directed with the axis of the patient rather than angle. So this produces lesser artifact because of the area that needs to be penetrated by the beam than this direction. In this direction, you will have more area for the beam to pass through, so the artifact will be stronger. Make sure that you are positioning the leads in a way that if the table moves, the leads will not be pulled out of the patient. Okay, so you have enough distance and length of the leads for that certain patient movement. Also keep in consideration that if the patient is nervous or anxious, they will sweat more than normal patient. And this sometimes causes the leads to loosen. And the ECG, you will see ECG fluctuation on the monitor. When you try to position the patient, one thing to keep in consideration that the patient has been sitting outside, they are stressed, they are tense, their muscle is tense, and if you keep them or put them in position and they are still tense, they might reposition themselves during that exam, which will cause a change in position or a motion artifact. So it's a good thing to do is to ask them to stretch before the position. So if you are doing spine or spine CT, it's a good, or a shoulder CT. It's a good thing for them to ask them to stretch their shoulder and neck, okay, to make sure that they are comfortable. And some of the procedure will require that if it is for TM joint, for example, you ask the patient to open their mouth and on both sides, up and down, just to reduce the tension. They want to see the TM joint in a relaxed position rather than this tense position. So keep this in consideration. Avoid raising the arms of the patient with a pacemaker, okay? Especially if they have a new pacemaker put in within a month. So when you are raising their arm, the leads might change position, and it will cause fluctuation in heart rhythm. So it is important, extremely important to make sure that the patient is comfortable on the table. Why? And it reduces anxiety, and if you reduce anxiety, you are controlling the breathing rate and the heart rate. Eventually, at least it will also reduce motion blur. This is special recommendation for CT rest. You can do it both ways. When the patient is sitting on the end of the table, as in this position, or you can make them lying down. According to radiologist request, which one is better? For the patient for the patient sitting on a chair is more comfortable, but take in consideration that this will give more, theoretically, more radiation dose to the thyroid, the lens of the eye, and the breast. Okay? We have to protect the patient and at least ask them to look away from the country. If the patient is not comfortable on the table, they might move during the procedure and produce a motion artifact very clearly visible. Most probably, it should have been avoided. When you are centering the patient, starting from the topogram, make sure that the area of interest is in the center. We'll avoid the off-center artifact, okay, which sometimes will show as subdural hematoma. It can be avoided. With hyperesthenic or very obese patient, very large patient, first things first, they are humans. Don't look at them in a disgusting way. Okay? What they need is they need your help. They don't need your sympathy. They will face difficulty, and consider also that they will face difficulty in breathing when lying down. So your examination in that specific condition has to be fast. You have to prepare everything. What they do is they even put the cannula while the patient is sitting. They only ask the patient to lie down when they want to start the examination. One very important point is that make sure that the weight of the patient will not exceed the allowed table limit. For example, some of the tables will allow 200 or 240, 280, 300. Make sure that it will not. If you don't follow this, it might lead to an artifact. For example, you will see lines in topogram. These lines are jerking lines because the table has a very heavy load that it's not able to move properly. And also which might look like a stair-step artifact when you are reconstructing the image. With hypertonic or obese or large patients, you might face also the out-of-field artifact. If the patient size is not exactly in the center and to one side, you might see that part of the patient will look outside the examination field, scanned field. So this is one of the difficulties. The other difficulty with large patients is that you might tend to position them according to soft tissue. Avoid this. Try to avoid them to position them according to the bony landmark. Okay, this will give a better position, although it's not 100% foolproof. Large breast shadows. This is another challenge. For us, definitely provide privacy. First of all, female patients will definitely prefer female technologists. If it is important to reposition the breast tissue, what you can use is a sheet under the breast and try to pull them upwards if the area of interest is down. Or in some situations, they used plaster even. Okay? It's a very sensitive procedure or situation, but if you speak with the patient and try to explain to them why it is important to reposition the breast shadow, they will confirm with you. Again, remember that with large breast shadow, it's difficult for the patient to lie down. Try to provide oxygen. If you want the patient to relax even more for a longer procedure, you can provide a warm blanket. There is also, this is science backed. Providing warm blankets will make the body of the patient secrete tranquilizing enzymes, which will make them relax. This is good for adults and pediatrics. If you don't have the warming blanket, you can use a heavy-weighted blanket. Any blanket which weighs more than 7 kg or 15 kg, up to 15 kg. For example, this is the type that we sometimes have in the hospital. This will have a calming effect also. In pediatric patients, Philips has a playable scanner. It's called kitten scanner, and it is set in the waiting area for children to play around. When they applied it, it has reduced the amount of oral sedation that was given to the patient. The child will be encouraged to try the procedure without fear and without the need of sedation. This is something to think about. Contrast media. Now, there is a controversy about explaining to the patient about the effect of contrast media. And several books, they have different theories about it. Some of the textbook will say, don't tell the patient about the effects of contrast media. If you tell them that they will get a hot flash, they will feel it. You don't tell them, they will not feel it. While in other textbooks, it recommends to tell the patient about the hot flash or the bad taste in the mouth from contrast media, because if they get it and they don't know what it is, they will be afraid there is something wrong. It's not normal to have this feeling. So it might disrupt your examination. For me, for my personal preference, I prefer to tell the patient in a way that they are reassured, not in a way that they are made afraid. Ring artifacts. I don't know how much you've seen it, but one of the reasons I wanted to talk about, it has several reasons. One of them is failure of the detector. So if you have a set of detector, if one of them failed or multiple ones have failed, you will see a ring artifact around it. So, but what I wanted to, and sometimes it's not total failure, it's just miscalibration. It needs calibration. What I wanted to talk about is the contamination from contrast media. If contrast media seeps into the gantry over the detector, it might cause a ring artifact. Make sure that you or the engineer, and if you make sure that you don't, contrast is not leaking or dripping on the gantry. And if you see any, just try to clean it before it goes inside. Sometimes there is a partial ring artifact. Noise. The unfortunate thing about noise, and the good thing is that there is lots of software that reduces noise. But if you want to reduce the noise manually, at least you multiply the mass by 2 times. It will increase the signal to noise ratio by 40%. Other factors, sometimes we cannot control it. For example, the patient or part thickness. The more it is, the higher the noise. The slice thickness, if we increase the slice thickness, noise will be reduced. But sometimes we are limited to, according to the indication, clinical indication, to slice thickness. Beam hardening. Beam hardening is the artifact that we see. For example, in this image, we see a darker center, a lighter area around it at the edge. And this is beam hardening. It can be modified using software. Another type of beam hardening is the streaking artifact, which is sometimes we cannot modify it. For example, this area, this dark area, this is also due to beam hardening from the dense bone in the mastoid area. Metal artifacts, very visible star-shaped artifacts. Okay. And there are lots of artifacts that you can go through. You can go through each of them. There's more. What is the future perspective? Hopefully, the X-ray tube will be modified to a micro source or a zero source instead of an area, just a point source. Okay? So that we'll have a better or higher resolution image. The past future, which long time ago or short time ago, this was considered as the future of CT scan. The electron beam CT scan, the 5th generation, it used to be very, very fast. It was like 0.75 seconds, less than a second for 4 scans. It has 4 rows of detectors, and it could scan 4 slices in less than a second. And this in the 80s was considered very, very fast. So almost 25 years later, with dual source CT scan, they reach almost the same timing with dual source. It became very, very fast, from 120 in the early days, 120 seconds, to less than a second with faster computer and dual source. So this was considered as the future of CT scan. Now, the near future, current future, they are working on a multi-source X-ray tube CT scan. And instead of a dual, instead of 2, you can put 3. Okay, this will reduce exposure time even. So it will be like, for example, here. Or there is a working a prototype, a small prototype. They tried it on animals, and it is a multi-source, so it has like 5 or even more than 5 X-ray tubes. And so with this configuration, the X-ray tube doesn't have to rotate, nor the detector. Why? Because the future, they are not looking, they forgot about reducing radiation dose about CT. They don't concentrate much about it. Now their focus is on reducing speed. They are still looking at ways to reduce, but I think they reached the maturity level of reducing radiation dose. Now they are looking for ways to make the CT scan position faster. Now, visionary future, that was the current future. Now, the visionary future, what we should imagine to happen in the future is the multi-source CT with a possibility of real-time CT imaging. So there is no waiting time. It's like, it will look like fluoroscopy. And there is no rotating anode, rotating it. And also, the X-ray tube will have a lower loading rate. It doesn't have to be that expensive because the load will be distributed on all the X-ray sources on the machine. The other possibility is to have an open-sided CT scan, which can be used in operation theaters for localizing or so on. So this is a possibility. If you have a gap here, you can make an open source CT unit. Similar to this, this is an O-arm. This is a CT scan, but it is O-arm. But just imagine if we have a gantry shape like this. This is also a possibility in the future. The artifacts that can be avoided or minimized is, one of them is the pseudo-enhancement artifact, possibly, and ring artifact also, and motion artifact, and other artifacts maybe possibly can be avoided. Thank you very much. I think I did not take a very long time. Thank you very much for bearing with me. I will take your questions after my colleague's presentation.
Thank you, Mr. Mahdi, for this valuable, informative, and interesting presentation.